Hello, I'm Dr. Muireann McNulty, a chartered clinical psychologist and accredited psychotherapist.
And I'm Jean Notaro, and I'm an accredited psychotherapist. And Muireann, myself, and Dr. Emer Farrell, clinical psychologist and accredited psychotherapist too. All three of us are advanced certified schema therapists, supervisors, and trainers.
And we're delighted to be facilitating an individual adult schema therapy training accredited by the International Society for Schema Therapy at PCI College in 2022. Schema therapy is an evidence-based psychotherapy. It's designed for clients who present with problems and difficulties related to complex trauma and adversity in childhood. It was developed by Dr. Jeffrey Young for clients who didn't respond to standard CBT. It's an experiential and integrative therapy that incorporates a number of theoretical frameworks: attachment theory, gestalt therapy, object relations, cognitive and behavioural therapy.
And at the heart of schema therapy is this idea of core childhood emotional needs: a need for safety and protection, a need to connect with others, a need for autonomy, a need to express feelings and needs, a need for realistic limits too, and a need to play and to have fun. So through a combination of interview and completion of schema questionnaires, the schema therapist will work with the client to collaboratively identify their unmet childhood emotional needs and perhaps the schemas that formed in childhood when these needs were chronically unmet. And an example would be perhaps a need for connection and love being chronically unmet and schemas forming around that of being defective and unlovable. Perhaps, again, by way of example, a need for safety not being met and a schema developing around mistrusting others or perhaps being vulnerable to harm. So through experiential and cognitive work, we work in schema therapy to heal those maladaptive schemas.
And this course will cover the schema model and the 18 maladaptive schemas, the schema mode model and the main child modes, the vulnerable and angry child modes, the adult modes, the healthy adult and critic modes, and the coping or protector modes that we can think of as a surrender, avoidant, or overcompensating mode.
And we'll also look very closely at how to create schema formulations for clients with complex and adult difficulties. We'll also learn about and have a chance to practice the main schema therapy interventions, such as limited reparenting, such as empathic confrontation, chair dialogues, and also imagery rescripting.
People often associate imagery rescripting and chair work with schema therapy. And yes, these are techniques that we use and they're really helpful. But the most important technique is limited reparenting. The therapist tries to meet the unmet needs of the client through the therapy relationship and through experiential exercises so that the client can experience what it's like to have those core needs being met, begin to appreciate what they've been missing emotionally for much of their lives.
Mm-hmm. And also learn to grieve maybe and to express anger about that and to ultimately learn to treat themselves differently, to perhaps internalize their own well-functioning healthy adult who treats them better so that their needs will be better met in relationships going forward.
Yeah, so people who benefit from schema therapy are those with difficulties that meet the ICD-11 diagnosis of complex trauma or the DSM-5 criteria for PTSD with childhood onset. People who've experienced significant adversity, neglect, or abuse in childhood. So this includes the big T traumas like physical and sexual abuse, but also the small T traumas, the repeated misattunements, the failures or ruptures in attachment, the chronic invalidation or constant criticism. People who traditionally might be said to have personality disorders or traits that interfere with social and occupational functioning in their ability to establish and maintain satisfying relationships.
And sometimes we're asked, what about people who aren't suited to schema therapy? And yeah, there are those people too. And sometimes they might be people whose problems have predominantly adult onset, maybe perhaps problems that relate to discrete or specific symptoms for which we have an established evidence base, and people who don't have childhood adversity or trauma in their backgrounds, but also people who don't want to do trauma work, who want instead to focus on going forward and addressing only symptoms in the here and now.
So our course will provide the basis for people to work towards certification as schema therapists with the ISST. It's the only accredited course offered in the Republic of Ireland, and it's been delivered by the three of us, and each of us is experienced with working with schema therapy, using schema therapy as our foundational model or main model on a daily basis in public settings and in private settings. And we have particular experience of working with this model in an Irish context.
The training has already been run 7 times by us across the island of Ireland for experienced mental health practitioners with excellent participant evaluations. Participants of previous trainings have gone on following supervision in the model to achieve standard and advanced certification as schema therapists with the International Society of Schema Therapists.
Schema therapists work to provide this limited reparenting that we were talking about. So a suitable mental health professional coming forward for schema therapist for schema therapy training will be somebody who's caring and compassionate, someone who's attuned to emotions in their clients, but also in themselves, somebody who's reliable and responsive.
And perhaps also willing to repair and openly and honestly when there are ruptures in the therapy relationship, which there can be, and, also might possibly need to be boundaried and to be robust enough to set limits, to hold people to those limits and talk with them about perhaps what might be the most difficult behaviors they exhibit in their lives, those tricky sides of themselves, including behaviors that people in a social setting might rarely bring up, but that might be really important, that they might be part of why people are avoided or why closeness doesn't develop for certain people.
So this course will be delivered in 3 modules, and it will involve 8 days of training in total, and we'll use multiple learning modalities like case examples, lots of those, formal didactic presentations of key concepts and techniques.
And we'll also use video and live role play examples to illustrate and demonstrate the main key concepts and techniques. There'll be an opportunity to practice in dyads and in small groups, being observed, and also live supervision, almost like a live supervision, and participating in exercises to identify and to reflect on the therapist's own schemas and modes as they relate to the work.
So we really look forward to this training in PCI in 2022. And we're very enthusiastic about schema therapy, and we look forward to sharing that interest and passion with you